make sure you're making the right decision when it comes down to certain procedures. If the procedure don't need to be done on your back, don't go and do it, especially for persons who have met in an accident. A lot of times we find ourselves doing procedures because we need insurance money. Don't do it. If you can live and survive without those back surgery, and you can take a little pain medication and you feel a little bit better, go ahead and do it. But don't put yourself in a situation where the risk of you not ambulating after the surgery, the risk of you not peeing after the surgery is higher than you dealing with a pain of 4 out of 10 on a daily basis. Welcome to the channel. Welcome to the channel where it's all about nursing, travel, and lifestyle. All right. I'm just heading from my son's parent-teachers meeting. So I'm gonna see 3 patients today because it's gonna be a short day. It's very windy outside. Seems like it's gonna rain, and me not into that today. I'm not into it. The good thing about house call is that it's when you're on the road here, you don't have to think about joint commission, or you don't have to think about a manager or a co-worker not enjoying your music. You can turn up your music and deaf yourself. Yeah, man, if you're the kind of person that listen to music all the time and you put it on like very, very loud, then you're gonna be enjoying this, because in your own little company, when you're bored, you are going to go ahead and be listening to your music at your own level, at your own time. And you don't have to feel as though anybody is gonna be like, oh, you need to turn your music down, or you can't listen to a certain, you know, a certain kind of music. You can listen to whatever it is that you want to listen or play at that time, because you're in your own space. And that, I don't have anybody telling me that you can't do this now, you can't do whatever, because you're at work. So one thing about house call is that it's because you don't have anybody over you telling you that you can't eat at the desk, and you can't have your earbuds in, or you can't have your phone on speaker, or you can't have your phone on speaker because you're having a conversation and you don't want to put the phone at your ears. No, it's not like that. You can make your call at any time. You can eat at any time. The only thing is that you can't go to the bathroom at any time, because remember, you're on the road, so you're gonna have to find a gas station to go to and use it. All right, if you haven't trained your bladder and your bowels by now, then yeah, you're gonna have to stop at one of those bathrooms, those gas stations, to use it. But I don't have anybody telling me that, oh, I need to finish up the notes because they're gonna take off the patient off of the tracker. No, I don't have anybody telling me that. Or I don't hear anybody telling me that, oh, I'm gonna give you another patient, so you need to hurry up and see this patient and go and see the other one. No, I don't have anybody telling me that, oh, I put some new orders in for this patient and I need you to see. No, none of that. I just come, go see my patient, put my orders in when I feel like. Well, usually in a timely manner, and normally I see them and put orders in at the same time. But in terms of completing my chart, nobody don't need to be telling me that, oh, you need to finish your charting now, so we can actually close off or discharge a patient, or, you know, there's so many different things that they need to do. So that's a good thing about house call service now that I enjoy. I have the flexibility to do whatever I want, whenever I want, however I want, without getting my boss upset, or I get upset about something that is beyond, you know, fixing. All right, so yeah. All right, let me see. I don't even know where this patient lives. No car behind me. So this is what, apartment 1010 101, and I'm right in front of it, or almost in front of it. So why the park set so? Parking slots them set away, and everybody can do parallel parking. People and everybody can do parallel parking, you know. But these people set up this thing here for only parallel parking, and everybody can parallel park. So anyways, let's try to see if we can parallel park. You put the car there, then you lock it in right like this, and then if you notice that your driver door, oh, I think I'm too close. Am I too close? Oh, I think I'm too close. Let's go again. I think I started out too close. So lock it in, and then I put in this thing, and then I lock it in now. And voila, I am in. Just try not to let the car behind you. All right, and give it room for moving. And we're done. And that's the end of the driving lessons for today. All right, that's the end of today's lesson. So I'm gonna go in and see this patient. So I went in to see a patient a while ago, but the patient didn't want to be admitted, and then the second patient didn't want to be seen because they were like, oh, they've been having too many persons coming in to see them on a daily basis. So just letting you know that whenever you're doing host call service, it's very important that you confirm with the patients. A lot of times we might not confirm, but you don't want it to be a case where you waste the gas and drive to all of these persons home and you know, the patients don't want to be seen, because sometimes companies will go ahead and tell you that the patients have confirmed, and some of the time the patients are not aware. And then especially with the fact that, you know, we're working with a population of persons that tend to be a little bit forgetful. They have a little bit of Alzheimer's, dementia. You know, these are the individuals who definitely will not remember that they have an appointment confirmed by, you know, another person or themselves. And so it's very important for us if we can go ahead and call ahead of time, like a day before, just to say, hey, remember you have an appointment for tomorrow. So that way they can program in their mind that they are going to be seen or somebody's going to be coming to their house. Because one thing you don't want is to be driving 30 minutes to go and see a patient, and then the patient refuses to open the door because they don't remember having an appointment with you scheduled. So just be mindful of that. And then the other thing about it is that when it comes on to some of these appointments, you know, because you're not getting paid for the patients because you haven't seen them, then that is something you have to take into consideration as well. So what is going to happen is that you will have fluctuations in your pay. I always say that you can make money as a nurse practitioner doing house call service, because you can be working for different companies and be seeing those patients. I remember you're getting paid per patient. So the more patients you see, the more money. The less patient you see, the less money you do bring home at the end of the day. So in order for you to make money, you have to ensure that the company that you're working with is making is doing a good job at booking and confirming those patients. And if you want to ensure that, you know, the patients are really confirmed for that day, when they give you the list of patients that they want you to see, just go ahead and look up their telephone number and call them and say, hey, this is X calling from this company, just checking to confirm if you have an appointment for tomorrow. And the patient will tell you yes or no. Sometimes they will tell you no, they don't have an appointment because they probably don't remember, or probably they were booked and not informed of the appointment. So at least you will be able to confirm all of those patients and be sure that if it is 5 patients you're going to be seeing for that company, those 5 patients are expecting you. You know that your money is going to be there at the end of the week or end of the 2 weeks or however they normally pay you, because you've seen those patients. So you have to be a little bit more proactive and make sure that if you want to make a certain amount of money, if you want to see a certain amount of patients, you have to just go ahead and take up the responsibility as well to just double check to make sure those patients are confirmed for their appointment. So a lot of times as nurses, you know, we see a lot of things going on in the hospital setting. Sometimes you, even if you're not a nurse, sometimes you're at work and you want to go to the bathroom because you're having this cramping effect in your bladder. And so what you do is that you sit down and you continue to do what you're doing and ignore the brain telling you that you need to use the bathroom. And so I also ignore the fact that your bladder is telling you that you need to get up and go and use the bathroom. And so you don't really understand that you're blessed. You know you're blessed now, but you never really know how blessed you are, or me never really know how blessed I am until I see some things in the homes of these patients that I'm visiting on a daily basis. I just went and saw a patient a while ago, and this patient had surgery. She had a spinal surgery done the other day in January, and it turned out that after finishing her surgery, she has no control over her bladder. Yes, she has no control over her bladder. And spinal surgery is a very tricky surgery because it's something that, you know, there are so many risks along with other surgeries. There's so many risks when you take up there's so many risks when it comes on to doing a surgery. But the spine is one surgery that I'm afraid of. I'm so scared of anything to do with spinal surgery because when it comes on to nerve damage, loss of control and all of those things, it is something that I'm hoping and praying to God that don't happen to me. So I went in and saw this patient a while ago, and this patient had her surgery in January. She had a spinal surgery in January, and it is what? April now. And this lady hasn't gotten a chance to go to the bathroom because there was possible nerve damage, she says. That's what she said, the surgeon told her. So over time her sensation will come back. She said that she's in her car, she don't know that she urinate on herself. It's the same thing when she go to the doctor's office. She get up from the chair only to realize that there's pee on the chair. She's in her bedroom lying down, don't know that she pee herself until she gets up from the spot. And so sometimes she feels so embarrassed, and anybody would feel embarrassed about it. You understand? Because knowing that you went into a procedure, yes, you understand the risk, and now you come out and this is the life you're living. You're living with you not able to tell when you want to go to the bathroom and pee. To be setting alarm clocks to go ahead and tell you that, oh, it's 4 hours time now. The usual body would normally go to pee, so let me go and try and sit on the toilet and see if I pee. And she said when she go to the bathroom, it takes her hours before she actually pee. And God bless the amount of urine that does come out. You understand? And just looking at it, for somebody to be out of hospital for the last 3-4 months now and is not able to tell when she has a sensation to pee, it's frustrating. It is very frustrating. So I asked her about what about a catheter? Did you have a catheter in? Yes, she had one in at the hospital, and then they had to remove it because she was getting discharged. And her home health team told her that the insurance is not covering for urethral catheterization for her in the outpatient setting. So now she has to be there living like this, incontinent all over. If you go to the supermarket, she says she walk in and she don't know that she want to pee, and so only thing she's feeling on her right foot is urine running down, and that is just embarrassing and sad for her. So I'm just saying, when you go out there, make sure you're making the right decision when it comes on to certain procedures. If the procedure don't need to be done on your back, don't go and do it, especially for persons who have met in an accident. A lot of times we find ourselves doing procedures because we need insurance money. Don't do it. If you can live and survive without those back surgery, and you can take a little pain medication and you feel a little bit better, go ahead and do it. But don't put yourself in a situation where the risk of you not ambulating after the surgery, the risk of you not peeing after the surgery is higher than you dealing with a pain of 4 out of 10 on a daily basis. Who wants to live in pain? You understand? Nobody wants to live in pain. But when it comes on to you living without the fact that you're able to ambulate anymore, or you're not able to pee anymore because somebody do something, or the risk of the procedure cause you to not be able to do any of what you're normally able to do because of nerve damage and all that comes with the procedure that you already sign off on, think about the decisions you're making. And I'm not saying that is the case for this lady. Her case is totally different. You understand? But I know a lot of times you have persons who've met in an accident and they always want to go and do a ton of different tests because they want big money. When it comes on to insurance claim, don't do it. Don't put your health in certain situations just because of a little dough. Don't put your health in certain situations because of money. You understand? When it comes on to you taking a bathroom break, go and take a bathroom break. Because when your bladder is telling you that you need to go and pee, it needs to go and pee. So go and take the 5 minutes and go to the bathroom and do it, because you have some persons out there who don't have the opportunity to do so. You understand? You have some persons who don't have the opportunity to go to the bathroom when they feel like, because their bladder is cramping, or they feel as though it's time to go and pee because they're going on the road and they don't want to stop at any supermarket or any store to go and use it to pee. So make sure when your body is talking to you, make sure you listen and protect the little nerve endings that you have in your bladder and all of your other parts of your body. All right, and that is just what I'm just leaving with you right now, because I'm just feeling it for this patient, and she hasn't been seen by a urologist or anybody to say, okay, then let's talk about different options that we can do. She was being told that she's gonna have to just either live with it, or in 6 months time, 10 months time, however long it might take before she actually gets back her control. But 4 months is a pretty long time. You understand? 4 months is a pretty long time for her to get back bladder control. Not saying that there's not hope. I'm not saying that God is not alive. But I'm just saying, come on, there are different options that we can do. This is America. Apart from a catheter, this is America. I'm sure they have some transmitter or something, neurotransmitter, that can help with telling her that, okay, then now it's time to go to the bathroom. So this is what my evenings look like after seeing the patients. I normally take about 2 to 3 hours to try and complete all the charts. Sometimes it takes a little bit longer depending on the amount of patients I see, but at least I know I won't have that much to do over the weekend. So I normally just come here, sit down, and just get it out of the way. And for me, this is just, you know, it's just worth it for me, honestly, because if I go home, I find too much things to be doing, and I know that when I get home there is, you know, I need to do things, so I'm gonna just do it. And usually I'll just leave this and brush it off for the weekend. So in order for me to not do that, I just make sure that I just double check maybe 1 or 2 of the charts. I'll have it over the weekend, and usually the one that I do keep over the weekend is probably the ones from my other company, because their charting is just a little bit straightforward, and most of it I already did at the time when I was seeing the patient. With the second company that I'm working with, there's no way for me to do any charting on the job, because the charting system is just so complicated. And it's not even complicated because both companies do use the same thing. Yeah, so basically that's it. I have a patient that I am discharging, and then that's it. I have 2 more charts that I will complete on Sunday, and that's it for the entire week. I'll be done, so I can have a wonderful weekend, and I do hope you will have a wonderful weekend yourself as well. All right, until then, I will see you in the next video. Bye.